Here's something that sounds completely backwards. A bee stings you, and your first instinct is to flick it off, run inside, and put ice on the swelling. That's the reasonable response. That's what everyone does. But there are people who deliberately seek out bee stings, hold the bee against their skin, and let it happen on purpose, not once, repeatedly. And some of them are doing it on the advice of doctors. So what's actually going on inside your body when venom enters it? And why would anyone think that's a treatment for anything? The answer starts with what bee venom actually is. It's not a simple poison. It's a cocktail of compounds, each doing something different. And the one that matters most is a peptide called melittin. Melittin makes up roughly half the dry weight of bee venom. It's what causes the burning sensation immediately after a sting, but it's also what researchers keep coming back to in lab studies. Melittin has been shown to inhibit the proliferation of certain cancer cells by triggering something called apoptosis, which is the body's built-in process for deleting damaged or malfunctioning cells. Cancer partly thrives because that deletion process breaks down. And melittin, in lab conditions, appears to help restart it. That finding alone has put bee venom on the radar of oncology researchers studying breast, cervical, and prostate cancers. The research is early, but it's real, and it's getting serious attention. Beyond cancer research, venom also contains apamine, phospholipase A2, and several bioamines including histamine. And together, these compounds produce something that looks, on paper, like a fairly powerful anti-inflammatory toolkit. The body responds to a bee sting with vasodilation, bringing increased blood flow to the site, and that response pulls in macrophages, the white blood cells that consume foreign material and cellular debris. On top of that, the venom stimulates the adrenal glands to release cortisol, which is the body's own version of the steroid cortisone used to treat inflammatory conditions. So the venom isn't replacing the body's healing system, it's triggering it, telling it to activate responses that might otherwise stay dormant. That distinction matters. This is why arthritis has been the most studied application, with clinical trials showing meaningful reductions in joint pain for both rheumatoid and osteoarthritis patients. One study found that 82.5% of subjects receiving bee venom acupuncture reported substantial pain relief, compared to 55% with conventional acupuncture. That's not a trivial gap. And there's neurological research on top of that. A 2022 systematic review looked at bee venom in Parkinson's disease and found improvements in motor function alongside reductions in oxidative stress markers. Oxidative stress is one of the mechanisms involved in the progressive nerve damage that Parkinson's causes. So addressing both symptoms and underlying damage simultaneously is a genuinely different outcome than most conventional treatments achieve. Researchers are also looking at Alzheimer's and ALS. These are early findings, and the honest picture here is that most of the studies have small sample sizes, inconsistent dosing, and limited standardization. The scientific community is interested but not yet convinced. More controlled trials are needed before any of this becomes clinical practice for neurological disease. Here's the part that connects all of it back to something more concrete. The FDA has actually approved injectable bee venom, not for arthritis, not for cancer, but specifically to desensitize people who are severely allergic to bee stings. That application has real regulatory backing. The idea is that controlled, graduated exposure to the venom trains the immune system to stop treating it as a catastrophic threat and start treating it as something manageable. And that same logic, the body learning to calibrate its response rather than overreact, runs through essentially all of apitherapy's proposed mechanisms. But it also points directly at the risk. The same venom that researchers are studying as a potential therapeutic tool can trigger anaphylaxis, a severe allergic reaction that can be fatal within minutes. The compound that causes the most therapeutic interest, phospholipase A2, is also the primary allergen. So anyone considering bee venom therapy needs allergy testing first, and a clinical setting, not a beekeeper in a parking lot. The line between dose and damage is the whole story here.